Hi, I'm Dr. Ken Muhich from the Fibromyalgia Wellness Center, and what we're going to be talking about today is fibromyalgia and how you might be able to diagnose it correctly. In 1990, the American College of Rheumatology actually established a criteria to actually diagnose a fibromyalgia patient. One of the most important things in diagnosing a fibromyalgia patient is 18 tender points that are evaluated by a physician for a possible fibromyalgia patient. Now, I said tender points, not points of pain. So that's very, very important. To evaluate the points, no one should really be poking and probing in an aggressive fashion on these specific points. As you can see from this picture here, the 18 points are spread out throughout your body. Originally, there were 64 points, then 32, now there's 18. For a proper diagnosis of fibromyalgia patient, you should have at least 11 out of 18 of these tender points that are actually tender. Now, when we talk about tender, anybody can cause pain. Does that hurt? Pushing in real hard. We don't really need to do that because a fibromyalgia patient already is in pain. So what we do is we do it with two fingers, usually in light touch, where we actually press on certain areas, like for example the elbow, each elbow, or the occipital area, or the neck, or the chest. You don't need to press too hard for the evaluation of these specific tender points. In an additional amount of diagnosis along with that, you have to have whole body pain. And it should be for at least 3 months. And it's usually triggered by some physical, emotional, or chemical trauma. So for a proper diagnosis, one of the first things, like we say, is to ask patients a number of questions as far as history, background, and then the 18 specific points of tenderness, again, not pain. Keep that in mind when you go to any physician, or if you have any questions whatsoever, please contact us at Stetson Chiropractic Clinic and the Fibromyalgia Wellness Center, where we're always glad to see your back and other body parts. Thank you very much.